So thank you for joining us today for our webinar to learn how Geisinger Health System increased productivity and performance by improving its outsourced relationships. And our presenters today will share their industry insights, best practices, and experience around this topic. And we are also very pleased to have Dan Angel of Geisinger Health System with us today. He is the Associate Vice President of Revenue Management. And as many of you are familiar, Geisinger is a fully integrated nonprofit health system located in Pennsylvania.
Our hub is in Danville, Pennsylvania, which is you're familiar with Penn State, about an hour east of State College, Pennsylvania. On top of the 5 hospital locations, we have close to 80, I believe now, primary care and multi-specialty physician locations, serve more than 2.6 million residents in 44 counties. Our net patient service revenue on an annual basis is just under $2 billion, to just give you an idea of size. We've been very fortunate from a revenue management perspective to have won the HFMA MAP Award for top performing hospitals 4 years in a row. So we're hoping that streak continues, and we get pressure from our CEO every year. You're going to do it again next year, right? You're going to do it again next year, Dr. Steele says. So we're always trying to get better. So yeah, we're really here to talk about outsourcing, and my group is responsible to manage the outsourcing operations, and we always thought we did a pretty good job of working with our vendors in a transparent manner. We consider them an extension of Geisinger and our revenue management department, but we knew we could be better, and we had very bulky processes, if you will. We threw a lot of people at our outsourcing processes, both internally and with IT resources. So we knew that things could be better and we could be more efficient. And being a progressive organization that's always looking to bend the curve as far as innovation and cost, we knew we had to do something better. We work with a network of 9 self-pay and insurance outsourcing vendors. We use unique electronic connections and maintenance. We relied before the agency manager platform on vendor reports. They were really Excel spreadsheet type reporting, and again, very bulky, a lot of paper, a lot of, navigating to get the documents, and, just took a lot of time and wasn't the most efficient. We had inconsistencies in the notes, documentation on collection efforts from our various agencies. We had a dedicated resource for reconciliation processes and placing files with IT, and that should actually say resources. We had multiple folks that at one time or another, managed the files. So it was, again, a lot of hands-on work. Account level analysis was very, I can't think of the word, but non-robust, to be frank. We really didn't have a good way to compare vendor performance. And our invoice review which is a very key thing that I'd like to stress, because I've worked on both sides. I've worked on the vendor side, and you may not know it, but you're getting overbilled monthly, and you don't know about it. So that's a key point. We pride ourselves in doing it right and being the best, and that's kind of our Geisinger motto, is to be the best. That's what Abigail said. We knew it was okay, but we knew it could be better. Again, we knew it could be more efficient. At that current time, it was not efficient. We were throwing too many bodies at it. We could not ensure that we were being invoiced appropriately. We knew that there were collection opportunities, that if we had better data mining, that we could take advantage of increasing cash flow in certain areas. We weren't able to really fully hold the vendors accountable by comparing performance apples to apples. So, we thought we were doing an okay job, and we knew we had opportunity to be a lot better. So, what did we do? Well, we had heard about this up-and-coming organization or company called Conance, and had done a lot of work. And we really, I'll be honest with you, I kicked the tires a lot before we decided to go with Conance. We like to make sure that we have a good, solid, hard ROI in place before we go into any engagement. We looked at what Conance offered. It was probably over a year of dating before we decided to get married. Some of the things that agency manager provided that we did really not have a good process as far as performance went was integrated work queue communications to track handoffs and special requests. So, Conance, the agency manager piece, has specific customized work queues for various types of outsourcing work, where we can go in and see transparently what the vendors are doing. We had some of that prior, but it was again all over the place, and it was not easy to access and really to analyze. Conance also offers rule-driven, executes and monitors hospital-specific policies and procedures. So basically, we tell agency manager what our procedures and workflows are, and they basically put it into the system, and the vendors are responsible to comply to those procedures. And really, it's hard for them to not comply because the tool basically drives the workflows. So that's an important point I'd like to make. One of the big things was the reporting. The reporting is comprehensive. Our favorite reports are liquidation reports, exceptions, reconciliation, close and return. We really have great reporting that I can provide to my VP and my CFOs and my staff on a monthly basis to really compare apples to apples what each of our like vendors are doing. So that is extremely important, and it's very user-friendly, pretty reporting, if you will. It looks nice, and high-level executives definitely like that stuff. Third-party commissioning calculations based on the Conance knows what inventory each of our vendors has, what they've recovered from that inventory, and based on our pricing, our fee structure with those vendors, Conance tells me how much I should be paid every month. If I'm not paid that, we have someone who goes in and audits, and we have found huge savings on being billed appropriately, or if we're not billed appropriately. Conance can handle virtually any vendor type, and new vendors can come in and out, and in a very transparent manner. One single IT platform connection. It's web-based, so the connectivity is fairly simple to each platform. Platform takes on the account placement, recall, and reconciliation and tracking. So basically, to put it very simply, it's Geisinger to Conance in the middle as kind of the spoke, and then, or the wheel, and then all the spokes are the different vendors that we work with, and all of that activity is now managed by Conance. So it has created much more efficiency. I basically have one person now who has to touch Conance, and that's all they manage. So that really helped me gain economies from an FTE perspective as well. So how did it work out? Well, we have seen an improved yield. Our yield rates, as you see here, and cash recovery approved across all vendors with the new program. And some of the areas that we saw the improvement was increased recoveries. As you can see, I'm not going to name agencies, but you can see we yielded, based on 2011 volumes, about $500,000 in cash improvement. And again, when we do ROIs here, we really try to make them hard ROIs and not soft ROIs. So, by sharing these numbers, I'm, telling you that this is primarily related to CONNETs, these increases. We've seen a lot of challenges in the marketplace, as you're all probably experiencing, with, higher patient cost shares for insured patients, more unemployed people out there, and it's really getting harder to collect. We've actually seen the opposite. We're seeing our collections improve with our vendors, and that's benefiting them as well. They're getting higher fees. We're getting more cash in the door. So you can see by this slide, an example of that improved performance. The next slide, I had alluded to the elimination and reconciliation, the reconciliation of invoices and the elimination of errors. You can see that over the same time period, basically CONNETs tells us if an invoice is not accurate compared to what CONNETs shows. And our prior experience adjustments have increased to 10.2% compared to our prior experience, which was about 3.5%. So that's an incremental close to $100,000 in annual cash that we are seeing based on being invoiced incorrectly. Now again, we're netting the $95,000. There are also cases though where we've gone to the vendor, and I really think that helps our relationships, and said, we were underpaid, or you were underpaid. You should have been paid for these accounts that were reported as closed out in our system, but you actually were still working them and should get credit for the payment. So it works both ways. We were fortunate to find that we gained about $100,000. And it helps the vendors look at their processes. Maybe their cutoffs are at the end of the month when they're generating the invoices are off a few days, and a few days can make an impact in getting credit for recoveries that they should not have. So that's a big piece of it as far as the ROI goes. And we've certainly seen business office productivity. I won't go through every slide or every bullet, but we definitely have easier and faster access to reports, which I think I kind of alluded to. Aging reports, acknowledgement reports. We reconcile every file through CONNETs, so we know that. Like I say, we know that they know that we know, but we know what they have, they should have. So that's the important thing. Increased efficiency and tracking of responding to agency requests. So now if there's a complaint, rather than a phone call or an email, the complaint can be logged through work queues in the agency manager system, and we basically work it. We have a dedicated resource that basically manages the complaints and works to resolve them with the agency. We alluded to the reconciliation process. We are very clean in our reconciliation. Clarity of account location. In the past, we really didn't have visibility as to whether multiple agencies were working the account. So, I mean, I'm sure you've all experienced it. IT's got 50 million things on their plate, and they send a file to this agency, and then they send the same accounts to this agency, and both agencies are working the accounts, and then the patient calls the CEO and starts freaking out as they should, and we don't have that with the agency manager piece. Gives us visibility to data issues that previously we may not have identified or identified in a timely manner. So, really from a business office, and when I say business office, revenue cycle, back-end agency management experience, we really, very simply, I had several people working on agency management in the past. I hired one smart, very educated, bright college kid, and put him on CONNETs and said, learn it, use it, and manage it. And then you work with the agencies. And obviously I work with the agencies as well. But he basically has just taken the program and he owns it. And that's really all you need. I don't need all these IT resources anymore. He can help manage the files. He can produce the reports out of Conant. It's really a neat process. And, I'm trying to create another one of him, because if I ever lose him, I'm in a lot of trouble. So, from a compliance perspective, as everyone knows, the requirements now to get reimbursed by our federal government when it comes to the cost report, the bad debt, the indigent piece, as well as the Medicaid secondary to Medicare, is becoming more and more scrutinized. And I believe the reimbursement's also being cut down to 65% for a lot of the various sections. But it's very important from a cost reporting perspective that we have good documentation to support our collection efforts, that when accounts are closed and returned by the agencies, we have that documented and we have those accounts flagged, because the auditors will check that, as you all know. So, the platform really helps us with our Medicare bad debt reimbursement from that standpoint. So, recall rules are built into the platform to ensure all of the Medicare and non-Medicare accounts at that are recalled back according to what our policy is. So our policy, for example, is if you don't have, as the agency, a payment plan set up or a promise to pay within 6 months, close and return the account. So those recall rules are in place, and those accounts are pulled back through agency manager within 180 days. And, we obviously can then report on all of that activity, and that helps us from a work with our friends, too, in finance reimbursement to, reconcile to what they have and, the PSNR. So if it's not working, then we work with the agencies to correct their processes. Conants will tell us that, hey, this process is not working. So, and again, getting back to the tighter compliance, collection activity is very important. We have the tools and this is an example of a report where, we can determine that our patients are being treated in line with the expectations that we have as a revenue management department. This is an example of 2 of our EBO vendors and some of the letter and call activity. And I apologize, I left my glasses at home, so I'm squinting here at the screen. I think this is call activity. And, what we're able to do, again, is compare apples to apples, which we really couldn't do in the past. So, in this case, we're able to compare the activity of one vendor to another and share, our experiences that we've seen to say, hey, vendor 2 is, outperforming you by 2% on recoveries. And one thing that we notice that they do is they start calling on accounts a lot earlier. So, that's something that you may want to implement. And, they're calling on these accounts in this balance range at this time frame. And, we think that if you followed that practice, I mean, we're not telling them what to do, but, again, being transparent, being, part of Geisinger, an extension of us, we think we have the right to share that information if it's going to benefit them, because it helps them with their collections, and that helps their fees. So there's an ROI on their end. So we do not hesitate to share that information. And this is an example of how we could do that. We had, I don't think it's on this report, this presentation, we had found that I think these were primary bad debt vendors. We had found that one of our vendors was not calling on accounts less than, I want to say $300 until day 6. They were trying to just send letters and see what that would generate. The other vendor started calling at 30 days, and I think they were calling on accounts greater than $100. Well, what we found is that vendor was collecting in the first 60 days, was outperforming the other vendor in recoveries by 5%. I mean, that's significant when it comes to bad debt. So Conant's, the agency manager platform, was able to tell us that. And, we should share it. We did share that with the vendor. and it was very helpful to them. They didn't tell me if they implemented a change, but yeah, their yields improved. So bottom line, what we've experienced, and again, this is just our experience. We saved close to $100,000 in invoice errors. We improved our yield from our existing vendors by $571,000. And again, that $571,000, that's not improved cash. That's improved cash based on placement. So, if our recovery percentage increased, that's the important note there. We had FTE savings. I cannot share that information. That's the only reason I don't have it listed as part of the ROI. It's just internal stuff that marketing would slap my hand for. Tighter compliance. We've identified issues that we did not know existed since we've went live. We're able to trend our activities after closure, and we've identified accounts active at agencies but closed by GHS. So getting back to the reconciliation piece. Vendor network flexibility optimization. The value is been able to make serious vendor changes since go live. Although we have not, again, lost a vendor, we've been able to point out that certain vendors are, I'll use the word on notice, because they're being outperformed for similar business by vendors who are getting the same business. So, we're constantly challenging, as we challenge ourselves, to be better at what we do. We had a streamlined implementation of 2 new bad debt vendors, very transparent process. Sometimes the implementation of agencies onto your platforms can be, take a long time, and we're able to get new vendors on very quickly. And then streamline the conversion of pending vendors, and I think we also have 2 eligibility vendors that work at 2 of our larger hospitals, and they enroll patients in medical assistance programs. So we've been able to pull them onto the platform as well, which has been very helpful to us. And then we've much simplified our IT support. We really have much less of a reliance on IT. As I said, really my college kid is really managing a lot of it. So we've saved a lot of hours from that perspective in maintenance.